Good morning, friends. We are going to continue our teaching on hypertension. Earlier on in episode 1, we defined hypertension and we also stated some key facts about hypertension. Today, quickly, we're going to be considering episode 2 and we shall be discussing the cause of hypertension. What is the cause of hypertension? If you are here watching me and you are wondering what could have been responsible for your hypertension, or that of your siblings or friends or well wishers, pay attention. You must have also gone to the internet or gone to many places to ask questions and you are still confused, you are still not satisfied. Okay, but I'm here to make it simple. I'm just here to simplify it. What is the cause of hypertension? The principal cause of hypertension is the persistent narrowing of the arterial blood vessels. The persistent narrowing of the arterial blood vessels. When the heart pumps out blood, it flows through the to the blood vessels, okay, at a certain pressure. If by any reason the pressure of this blood flow increases, then hypertension occurs. Okay, so let me give us an analogy. We are familiar with road construction companies like Julius Berger. When they are constructing the roads, they lay pipes for proper drainage system. Okay, when the gutters are new, water flows easily because at that time there is nothing blocking the system. However, with time, when people begin to throw in dustbin, rubbish, and everything they can, all substances into the gutters, these things begin to block the lumen of the pipes, thereby forcing the water to flow at a higher pressure gradient. Okay, so this is exactly what happens to the heart, to the blood vessels. Okay, so with time, substances begin to clog and block the arterial blood vessels, thereby forcing the pressure of the blood to increase. Now, what causes, what enhances, or what actually leads to the narrowing of these blood vessels? Okay, there are certain factors that can actually increase the risk of the arterial blood vessels to be narrowed. Okay, we call them risk factors or the predisposing factors. It can be called the etiologic agent. Okay, so in non-communicable disease epidemiology, okay, risk factors are broadly classified into modifiable risk factors and non-modifiable risk factors. Okay, so hypertension is one of the non-communicable diseases. Okay, so like I said, it's a silent killer. So we are going to be discussing the modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are the risk factors you can manipulate, you can modify, you can change. Okay, they are very important as far as the management of hypertension is concerned. Even all forms of non-communicable diseases, they're very important because you can modify them. We have lifestyle factors. In lifestyle factors, we have, let me start with diet. Okay, so diet changes are very, very important as far as hypertension is concerned. Okay, there are a lot of food choices we eat that increase the risk of people being hypertensive. Okay, I'm not going to list all of them, but just take note of the following: high salt intake, that is chronic salt loading; high sugar consumption, consuming food rich in high sugar level. Okay, high consuming food substances high in cholesterol, consuming food substances high in spices, okay, and the rest of them. Okay, so please, you have to cut down or minimize the rate at which you consume these substances. Now, you have alcohol consumption, chronic alcohol consumption. A lot of people consume a lot of alcohol. You keep consuming alcohol, you take 1 bottle, 2 bottles, 3 bottles, and so on and so forth, without knowing that you are actually killing yourself. You are increasing your risk of being hypertensive. Okay, and you are also increasing the risk at which your heart works more than it's supposed to work. You have smoking. A lot of people smoke. A lot of people cannot, control their smoking. anything smokable you want to smoke. I want to plead, I want to ask that you reduce the rate at which you smoke, or better said, quit smoking. Now, we know that it may be difficult to stop a habit that has been acquired, but it is possible to stop smoking or even to stop drinking. So you can talk to any public health professional. The person will take you through the processes. It's called smoking cessation, and before you know it, you will stop smoking. Okay. So there is also what we call lack of physical activity or inadequate exercises, sedentary lifestyle. A lot of people do not exercise. They don't engage in physical activities. Some people that are, some big men, they just get into their car, they drive to their office. After work, they come out get into the car and drive to the house. No time for exercise, no time for activities. Okay, so you have, if you do not exercise, you are increasing your chances of being hypertensive, and also increasing the chances of being overweight. Now, overweight can also lead to obesity. So obesity is another um, risk factor. Overweight and obesity is another risk factor for hypertension. Okay, so there are also the use of certain medication like birth control pills that people use that eventually increase the risk of of being hypertensive. There are also some other medication like antidepressants that people take that increase their risk of being hypertensive. So if you are taking any medication, consult your doctor, consult a physician, and be sure what you are taking. Okay, stop self medication. Let me quickly talk about the non-modifiable risk factors. These are the risk factors that you cannot change, the risk factors you cannot manipulate. Okay, age is one of them. The higher, or you know the higher your age, the more likely that you will be hypertensive. Okay, hypertension, or the prevalence of hypertension, is higher among older individuals as compared to younger individuals. So the older you are, the more likely that you'll be hypertensive. Okay, so understand this. You know your age so that you know what to do at this time. Another non-modifiable risk factor is genetics or family history. You cannot modify your genetic component, but you can take advantage of it and do the needful. If your parents, or one of them, or any member of your family history is hypertensive, chances are that you also be hypertensive. So be careful. If you have not diagnosed your status and you are sure that one of your family members, a family tree, or one of your parents is hypertensive, so it is time for you to go and check your blood pressure, so that you'll be able to know your status. Another non-modifiable risk factor is race. We have the black race and we have the white race. Now, studies have also discovered that people of a certain race, or race predisposes people to having, or their chances of having hypertension. People of certain race are being more predisposed to having hypertension than others. Okay, so quickly we're going to be stopping here. Next will be episode 3. In episode 3, we shall be discussing the types of hypertension, signs and symptoms of hypertension, and if time also permits, in episode 3, we discuss the management. Until then, keep locked, okay, on this channel. Don't change it. Thank you.